So welcome to our BVT series. I'm Marissa from Think Wholesome.
And I'm Siri. I'm a friend of Marissa as a fellow BVTer and by profession a chemical engineer.
We basically decided that it would be really valuable to put together a series kind of documenting our experiences. We are similar time frames into BVT, Siri's a little further along. But we're at like that 6 to 8 month mark, and we've just realized that there is a big gap in the science-based knowledge in the BVT space. And so, as time has kind of gone on and we've been sharing, more about VENOM and our experiences and thoughts and all of that, we found ourselves answering a million questions, and a lot of them are the same. And so we thought that it would be helpful to compile this for you guys all in one place. And this will be a 7-part series where we just kind of share all the things that we found useful through this journey.
Yeah, and just to add to that, we are not doctors and we are not trying to be in any way. And part of the earlier series will be talking about how you can really put together a good medical team to support you and to see you succeed. All we can do is really share our experiences and talk about what worked for us, but in no way do we see this as giving you medical advice, and we're not authorized to do that. We just want to create a supportive kind of frequently asked questions series that we can have in one place, such that it will be easier for folks who might be interested, and again with the supervision of a medical team, can really look to this modality for addressing not only Lyme disease and other co-infections, but potentially other problems that they might have that VENOM has been shown with evidence-based research to potentially address.
Our whole thought here is that everyone's healing journey is different, and as close as we are and as similar as our stories are, we really have come to this from a different place. And we really just want to preface that this isn't a one size fits all solution, and we don't want to answer really specific questions here, because things like supplementation and all that stuff, we'll get into it in later videos, but just know that we won't be going into the very specific details, and that's why we'll be teaching you how to build a medical team that can help you build out your supplements, whatever that may be, in a way that is right for you and your body.
Yeah, and because Lyme disease expresses itself so differently in everybody's bodies, and there isn't a lot of research that has been done specifically in how Lyme disease affects BIPOC bodies, there isn't one, again, tailored solution for how to do any treatment. And we're not also sitting here saying that VENOM therapy for Lyme disease is the best treatment for everybody out there. Again, from our experience, it's what worked best for us. And we're not trying to be pedantic or trying to be teachers in any way. Again, we're just trying to share that for our own bio-individual needs, certain things that we did or didn't do, again, under the care of a medical doctor and with the supervision of a medical team, we feel comfortable advocating for this therapy and sharing our experience and kind of showing you where we were, where we are at, and where we hope to be.
Yeah. I think without further ado, we should jump into sharing about our stories, so you guys can really get a sense of where we've come and where we are now, and just what that's looked like for us. So do you want to start sharing yours?
Sure. So I was diagnosed when I was 22. Right now I'm 24. And I was being prepared for invasive heart surgery for a condition I was suspected to have had, which was called superior mesenteric artery syndrome. And I was diagnosed after I took a gap year from college because I was really sick and mentally just really struggling, and so I took some time off. And that fall, when I went back to school, I was diagnosed with stage 3 Lyme disease. And after that, kind of all the diagnoses just came piling on. The other co-infections, I have Bartonella, Mycoplasma, clinical babesiosis, et cetera, et cetera. I mean, most of our journeys in this way are pretty similar. You open the door and then the diagnoses kind of come spilling through. But yeah, right. I was suspected to have had it for about a decade, and I'm from Connecticut, and so, you know, the place where Lyme disease was found, and so I still really struggled to get an accurate diagnosis in a timely manner. One of the big things for me is that I have or would have a lot of memory lapses and would just black out. So when I look back in retrospect to like periods in my life, like I just don't really remember, and I can't really think about how I might have like been able to safely get home from place A to B because I would honestly just black out. I don't have those memories. And kind of when things started getting bad for me was when I was in a series of car accidents, which, you know, damaged my spine and I was unable to walk. And at that point was when a lot of the dysfunction came piling out. Around the same time, I had lost about 20 pounds because I had so much distress in my gut. And between going to doctor's appointments and trying to keep up with school, it was a really low, strange time for me because I had to do a lot of it by myself because I went to school in upstate New York, which was pretty far from where my parents lived. And I was dropping out of all of my classes and really was really close to failing, but, you know, was just really sick and had no idea. Routinely checked for depression, was feeling like life really wasn't worth living because of the constant physical pain, not because, you know, really the maybe typical or traditional ideas that maybe people might have about depression. I was just in constant pain and didn't think like life was worth living. And then I started VENOM therapy with the support of my naturopathic physician and my medical doctor after a year or so on both herbals and antibiotics, and honestly not feeling the relief because I had gone so far without being properly treated that it was kind of too late for me. And as we'll get into, long-term usage of antibiotics are not even effective for people with Lyme disease past a certain stage. But I'm almost 9 months into my BVT journey, and to come here to film this, I drove 8 hours, which is really crazy. I did not black out, or I did not have any sort of a period of time in that drive where I felt like I, you know, like was gonna pass out.
And you had so much energy when you got
I know.
Like,
I was like ready to go. Yeah, I was like playing with her dog. I was just like chilling. You know, like awesome. My brain fog has lifted. Many of my neurological symptoms are still present, but they're drastically improving. And just from a year ago, like more than a year ago, maybe from last June to now, my functionality has drastically improved. I would say that I'm about like 70 to 75% functioning consistently on a daily basis, which is incredible for me. So that's my story. I mean, it seems like, as Marissa's going to tell you, it seems like her story is like kind of similar to mine, but obviously with all of ours, it's like we have these little nuances, and us sharing is kind of just, again, trying to, you know, humanize our experience and show you that we have really like been through a lot of different things that have really made us believe and see the effects of BVT in like in a truthful way.
Mm-hmm. Yeah, I'm so glad you shared. And I mean, really, like, as we were, this is kind of an aside, right? But as we were writing these stories out, like, we sat down and we were just like shocked at everything that we've gone through, and we really just wanted to bring that to light because Lyme disease is just horrific in so many ways, right? And like one of the biggest parts is that the lack of, you know, I mean, being in Connecticut and still not being tested and diagnosed when like that's where it's from is just crazy. And we just want you to know that like you're not alone, and just, and, you know, for the fact that you're not using a cane maybe, or it's not, you know, it's not like we have a cast on and it's not maybe so readily apparent the struggles that we go through day to day. Like, we want you to know that you're not alone in this, and that, you know, your story and your voice really matter.
Yeah, and also, you know, kind of just to add to that, I mean, it's kind of like, as much as an invisible disease that Lyme is, we also just want to clarify and say that, like, even though we're like put together right now, like earlier in the day, we just had like a really tough morning.
Yeah, full moon life.
Full moon,
if you
right?
know, you know. Yeah, like, this is just one glimpse into the life, right? And the way that you're probably used to putting on a front for work and family and friends, and you know, just knowing that like this is a safe space, and we'll get into it later of like how important we think it is to find like-minded people that you can just feel really comfortable and authentic with during your journey. As for my story, it's actually crazy how many similarities we have in our stories. I was diagnosed my junior year of college. I'm from the Bay Area, San Francisco area, went to school out in Pennsylvania. And they originally thought that I had gotten my tick bite in Pennsylvania, but based on my symptoms, like my junior year, I was in stage 3 as well. And they were like, you may have probably gotten this in California. And so that part is kind of just a gray area, but definitely by my junior year of college, it was already, that chronic stage 3 phase that Siri was talking about. And I found out that I had Lyme disease, by my freshman year, like the second half of my freshman year, I was already starting to feel a lot of that dysfunction. And then my sophomore year, I was sleeping like 20 hours a day. And I sorry, college roommates, if you're watching this, I was so tired and boring, and didn't have that traditional college experience as a lot of us didn't, and that's something that we can never get back. And it's something that, people didn't know, all of the layers involved in, you just don't want to go out. Well, it's so much more than that, right?
Unmotivated, lazy,
literally
standoffish.
The amount of times that people thought that I just was faking because I wanted to turn an assignment in late, or I wanted some sort of pass, and I was like, I would give anything to not have to, need any extensions or whatever that looks like. And so sophomore year, the dysfunction was getting really bad, but I was still pushing through. I was planning to study abroad in Germany my junior year. And so I ended up going and had to leave early because when I was out there, I just got, it just hit hard. And I remember, similarly, I ended up losing, 20 plus pounds. I was around 90 pounds. And just couldn't keep anything down. And it's just so hard, especially being away from family, being away from the culture that having to spend so much time when you're supposed to be there studying and making friends and, building these memories. We're spending time in hospitals and, getting tests done. And I remember that they were like, oh, you're dehydrated, you're allergic to gluten.
Yeah, it's that classic gaslighting, making you out to be this hysterical, tired woman. And it's no, I have something wrong with me. Stop gaslighting me.
Literally, I remember when
I'm shivering because it's everybody has this, especially women, right?
Yeah, and I mean, really, I remember I did a paper in college and it was about Lyme disease, and I remember reading the statistics about how long it takes for women to be diagnosed compared to men with Lyme disease. And women, it's you have depression, you have this. And I remember that doctors said that, and they're like, you have MS, you have fibromyalgia, you have depression. And I remember just looking at this doctor just so fed up. And I was like, well, obviously, how could I not, right? After everything that we've gone through, and not just us, right? We, collective, Lyme community, chronic illness community, it's so just disheartening, and it's why depression and all of those feelings of just life isn't worth living are so prevalent.
Suicide is a really big cause of death for patients with Lyme disease because we are just made out to be crazy, and we're made out to be just ridiculous and nuts. But thank God that we have medical providers who are, some of them, are in it for commercial reasons, but there are some who are truly good physicians who are trying to make patient outcomes better and improve our lives and putting their licenses on the line to advocate for us. And it's
and they understand what Lyme disease really entails.
They've received the right training. They on top of whatever conventional training they might have had, we are privileged to have really good doctors, but we know that others just might not have access or are still looking around.
So we'll definitely touch on that more on how share the doctors that we use and help you guys find people in your areas, your price points, all that. Basically, my biggest things after everything already mentioned, right, is that I ended up developing, I always hesitate to say paralysis because that just feels very intense, but I guess why would I not, say that's what it is, right? Down my whole left side, and I was telling Siri, I've played violin since I was in 5th grade, and then just literally couldn't anymore. And, you know, it's hard when you feel like something is just taking away your identity. And I'm eventually, you know, after leaving Pennsylvania, moved to Colorado, and I couldn't make it up the stairs to my apartment. Like the elevation, like my heart, you know, I was like getting dizzy, you know, all of those things. And that's when I was like, I really need to figure this out, because I can keep putting these Band-Aid fixes on, or keep telling myself that it's in my head, because that's what medical professionals, people we're supposed to trust, right, are telling me. But I know I'm able to walk upstairs, so something's up.
Right.
So yeah, I still have, you know, that like a weakness along my left side for sure. But I have definitely, I'm about 6.5 months in, and I've definitely seen a lot of improvement, especially like on the neurological side, and like a lot on the brain fog side. Like that to me has been some of the biggest stuff that I've seen, and just like a lot more energy. You know, nowadays it's like we can get up early and like go for walks and move, and like when we moved, like I spent the whole day unpacking boxes and all that stuff, and I was like, wow, thanks VENOM. Like, you know, it's nice when you can get out of your routine and see these things, like driving here and stuff, like to see how much more energy we really do have.
Or even just like simple things like walking your dog, or like going to the grocery store, just like, or even just like sitting up in bed, or like showering, washing your hair. Like those things are like, I don't know, I mean, I feel like both of us really struggled to do that for a while. Like there would be days where I'd just go without like really taking care of my body, and like now I take care of it like 24/7, you know. It's like my body's my priority, like my body's like my temple, like my like I can't abandon my body and myself
over everything.
And it's like you know, like both of us have really come into that as we've started healing. And I mean, it's kind of, you know, it's kind of tough to think about the fact that we kind of abandoned ourselves when we weren't feeling so well, but sometimes it's really difficult to really think in a broader way when you're so sick. But as we started recovering, we've been really, you know, allowed to enjoy these small wins and feel happy about what we can do, which is super positive, not only for us, but for our partners and our families.
Yeah, I mean, we definitely said that like the highs from VENOM are so much higher. Like our quality of life is very clearly improving, you know. And it's not to say that we don't have bad days, you know, especially when new symptoms come out of hiding and all of that stuff. I mean, today is a full moon, and we're like, you know, sitting here and we're like, we'll just be really authentic. And you know, but instead of sitting in bed and being sad about it, you know, it's like we're getting up, like nourishing our bodies with good food, getting in movement. And it's just been really nice to, you know, feel empowered to do that, and to have, you know, a treatment for us, right? Again, like you're saying,
bio-individual, like for our bio-individual needs.
That really just, you know, we're really seeing these improvements. So as you can see, like a lot of similarities in our stories, but again, like so many nuanced differences. But I'm sure, you know, we've heard so many stories. Like I'm sure that you guys resonate with parts of what we're saying. And, you know, it's just to remind you that you're not alone.
We hope that as we continue this series, we can continue to be educational, informational, and just, you know, sharing our experiences.
While being your cheerleaders.
Yeah, while being, you know, like supportive of all of your journeys.
Yeah, and authentic in ours. And so the place that we're really coming from is just trying to, like, we just turned on the camera, sat down, and started talking. You know, we want this to feel like you are getting true, authentic, you know, glimpses at what this day looks like for us.
Exactly. I mean, like, we didn't do anything special. Like, we aren't even wearing, like, makeup. Like, we're just, you know, trying to keep this as authentic as possible. And
wearing, like, our cozy bee shirts and our like, pants. The point of this series is to help you build out your medical team, build your scientific foundation, so when you do join those Facebook groups, follow influencers, whatever that looks like, you can have an understanding and a really scientific baseline to then pull what you need, bring whatever you need to your medical team, and not just, as Siri said, like solely rely on what people are saying in Facebook groups.
With all of this research, we've been really diligent to cite our sources to make sure that we are presenting this information again in a way that's sound and can be really convincing to your physician. as to the viability potentially of this treatment.
Yeah, especially since, you know, a lot of people kind of think it's wild. I
Or,
mean,
like,
we
fringe,
did like
yeah.
to think about stinging yourself with bees, right? So our goal is to really show you the science. You know, you can do with that what you want, but it's really just to arm you and to empower you to really own this journey. And the way that we don't even advocate for fully trusting medical practitioners, because at the end of the day, like, you know your body, and it, like in the Lyme community, especially if somebody says you're fine, just because they have a degree, you know, or a
Doesn't
license
necessarily mean,
doesn't mean
yeah.
they're true either. And so we just kind of want to bring that full circle, like the way that we didn't trust every practitioner and we took a lot of time to find the really good ones. We feel the same way about groups and individuals and all of that, that there are always really great pieces of information, and this isn't to discredit, you know, any groups and things like that in their entirety. It's just to say that, you know, at the end of the day, like, the science doesn't lie, and we want to empower you to understand that on a level where then you can take that to the groups, to your medical practitioners, to anybody, and can see when there might be disconnects happening.
Yeah, it's also just like to address the elephant in the room. Obviously, it's like really unfortunate that you have to do this, right? It's like in an ideal world, like we would all just be able to like go to just our general practitioner and be like, hey,
Trust
like
them.
I think like I might have Lyme disease because I have a bullseye like on my arm, and have the doctor be like, okay, like let me just order you some doxycycline. Like obviously,
that'd be nice.
Ideally, we would want to live in a world like that, but unfortunately, like especially when you have Lyme disease, which again is like so underfunded, so really discredited in the media, it becomes more of our responsibility to really advocate for ourselves. And so sometimes it's just difficult when you get all this information and you're not sure like what to do with it. But
what's real,
yeah,
know,
exactly.
what's factual, like
yeah,
where
and
it
so
comes from.
you don't want like to get information where you then take to someone who like is in a place of power, and then they're like, wow, like this isn't actually like real, like what are you doing, right? And so we're hoping to give you this information that has been diligently like researched and broken down, such that not only do you get these like little bites of like data, but such that you can actually do something about it and take, you know, feel and take control over your body, like your choices, like what you want to do with your health, while working towards finding a physician and a medical team that can help you recover from experiencing Lyme disease.
Let's chat about what you guys can expect from the rest of this series and what, you know, this journey will kind of look like.
Yeah.
So this is the first video in a series of 7. So there will be 6 more videos. Those will cover things like the do's and don'ts of building your medical team, the science behind bee venom, which Siri has like diligently scoured, you know, all of the open source info, and that is going to be packed with really amazing information. We'll talk about mold and resources around how you can work through your mold situation. We'll talk about histamines, antihistamine diet, all of that stuff. We'll talk about supplements. We'll talk about detox and resources to help you walk through all of them.
But the difference is that we are, again, giving you a scientific understanding of how this works in a way that's still palatable and understandable for you.
And fun.
Yeah, and fun too.
Hopefully,
Because,
right?
you know, sometimes it's like you have people who are really scientifically inclined and they use just like really big words and it like doesn't make any sense. And you're like, why did I even try to do this?
Yeah,
I'm
especially
so
with
foggy.
Lyme
Yeah.
brain. Yeah.
So just like packing it into like 3 bullet points that you can understand and hopefully do something with, but yeah, like all of these are going to be packaged and provided to you such that, you know, it can be something that you take on your journey.
Yeah, and you can find all of the videos obviously here where you're watching them, and there will also be summaries. They're going to be documents. We'll have PDFs that go along with these as well that will map things out, maybe a little more visually, have like clickable links to things, other resources, all of that stuff. So, you know, we're different learners, and we want to make sure.
Yes, we're like both kind of super visual, but like at the same time, like, you know, just
kind of audio. Like this is like a great start. And then you can, once you have this, you know, you can download the PDF, do with that what you need. If you're looking for more information, stay tuned, because we'll probably be diving more in depth about things where, you know, if you are interested and want to hear kind of the longer form to some of these, we will have podcast episodes coming out. But yeah, we really just hope that this empowers you to own your health, because that's been the biggest thing for us. Is that it's like we said, you know, it's not to be cynical, but at the same time, it's hard to trust any one person fully, and you know your body, you know yourself best. And our goal is to create these actionable little nuggets of, you know, true scientific backed information that can empower you to take that where you need, you know, learn those things, and to really help you on your journey to become, you know, healed, become the best that you physically can be. And
like someone saying that like it's either their way or the highway, or that there's like one way to do something, like that's marketing and not actually science. And so like, again, just we're not prescribing anything, again, because we are not medical providers and we're not trying to be. We're just trying to, you know, share, again, just our experience in hopes that it could help someone who potentially might be interested in this, but might not be sure about approaching it with a doctor, or like how to really, you know, get started, like might know about Lyme disease, but might not really know much about VENOM, like that sort of a thing.
Yeah, I mean, basically all the questions that we get in our DMs every day, like that's, like we kept saying, like that's what started this, is that we
like why not just put something together,
put it all in one place. So yeah, we are just like really excited. We hope that you find this useful. We hope that, you know, it empowers you, and we are planning to, you know, we'll have these 7 videos, and then we've been talking about, you know, doing a check-in around our year and a half mark as like that middle journey kind of check-in, and then we'll do another, you know, however many videos, a check-in at the end.
We know that our BVT journeys obviously aren't going to continue on forever, and like if you guys like certain things about what we're doing, or like you think that we should change something up, or there's like something else that would be helpful, like please let us know.
We love all criticism, you know, and feedback, good and bad. Like we're
feel free to like
I mean, literally feel free to reach out. Like we're making this for you. Like this isn't for us. Like we're doing this free.
We're doing this free, like with our time, like our resources, and it's just because like we do get a lot of like questions and sort of concerns from people asking us really medical questions that are like inappropriate for us to answer, and so that's why, you know, we wanted to start this with the really pure intention of like wanting to just share like what we've been through, and, you know, provide, you know, like feedback for you guys to then take and, you know, kind of do with as you wish,
as you see fit. So with all that being said, this wraps the first video. Otherwise we will see you in the next video, where we chat all things
team.
Bye.
See ya.